Welcome to the show, Brain Health, Unchaining Your Pain. We are live with the amazing Dr. Susanna Petche. Welcome to the show, Susanna.
Hello. Thank you for having me here.
Oh, you are most welcome. So for those that don't know Dr. Susanna Petche, she is a functional medicine GP, speaker and trainer, specialising in psychological trauma and its impact. She combines both personal and academic understanding of psychological trauma to train life coaches and healthcare professionals, which I think is so important in today's world, via her Trauma Sense program to become more trauma informed. And she's also part of an innovative NHS-funded holistic program for those with diagnoses of CPTSD and or EUPD. And she also works with one-to-one clients exploring how stress and trauma impact physical and mental health. And I'd love for you to, for those that don't know what they are, is expand on CPTSD and also EUPD, if you wouldn't mind, before we start.
Yeah, sure. PTSD, a lot of people will have heard of as post-traumatic stress disorder, and the C just stands for complex.
Okay.
So there's a difference. So PTSD tends to be what people just describe as everything being, but actually PTSD refers to when there is a one-off traumatic event, say a devastating car crash or just a one-off life-changing event. Whereas complex PTSD is when there are ongoing events that occur. So for example, child abuse or domestic abuse, where there are lots of things that are happening.
So lots of events that stack.
Exactly.
Okay.
And EUPD stands for emotionally unstable personality disorder, which is sometimes called borderline personality disorder. Personally, I've got an issue with those labels.
Me too.
I just hasten to add that what I'm going to be talking about today are my views only and are not affiliated to anywhere that I work. I feel very strongly that labeling with people with these, like saying personality disorders, can be really harmful for most people. And there's a lot of evidence showing that women who unfortunately live through sexual abuse, sexual assault, are, when they seek help, are then labelled with a personality disorder when it's actually a trauma response.
Yeah. And do you know, I totally agree with you there, because I recently learned that trauma is, the origin of the word trauma is wound. It comes from, I don't know which language it comes from, but actually it means wound.
Yeah.
And that is exactly what it is. I just can't get my head around why people label it as a disorder. It's got nothing to do with having a disorder. It's about healing the wound that you experienced whenever that happened in your life.
Exactly.
Especially if it's complex. It's not, and I know, Dr. Gabor Mate and Bessel van der Valk is very informed. We were talking about this before we came on, wasn't we? Is that trauma isn't just what happens to you, but it's what happens inside of you as a result of what happens to you.
Exactly.
And I think people, often are perceived as broken or faulty as a result of the trauma, but the reality is they haven't healed. Their wound hasn't healed because they haven't received the appropriate treatment, whether that's treatment that they can do for themselves or treatment that they need to get from other people to support them in healing the wound. And that, the wound is still open and it's still gushing.
Yeah. I mean, the way that I define psychological trauma is actually it's a normal response to an abnormal situation. That's it. So we tend to label it as disorders and there's something wrong, and for people to think there's something wrong, but it's literally psychological trauma is simply normal responses to an abnormal situation. The problem is when they then get stuck and someone doesn't work through them, but body doesn't work through them. We can talk about that more. But it's when they get stuck, when the memory gets misfiled, when these survival responses become habits, that's where the problem is. But it all starts out as a survival response, and they're all entirely normal responses.
Completely natural. because it's
Exactly.
like you said, it's survival of our species. It's
Yeah.
how we're programmed to survive.
Yeah. So labeling then somebody who has actually gone through a survival response as abnormal, as faulty, as something wrong with them is just incredibly harmful.
Yeah, I completely agree, and I'm super excited to talk about this because I'm very passionate about, you know, helping people recover from trauma.
Mm.
What are you passionate about in life right now? What fires you up?
Exactly that. I mean, it sounds really weird, and I have a lot of people just think, you know, so you just want to talk about trauma because people have this perception it's really depressing. Now, obviously, the traumatic incidents are horrific. However, there is so much we can do to help. There's so much that we can do to help prevent people get impacted. And then when people are stuck and impacted, there's so much we can do to help. And if that knowledge, if we can share that and get that out there, it could just transform people's lives.
Yeah, do you know, I absolutely agree. And I'm going to give a shout out to one of my clients, Senga, who, you know, the importance of going back in to understand your trauma and
Mm.
not be dismissive of it, and then being equipped with the right tools so that you're
Yeah,
not just unchaining your pain from your past trauma, but
mm,
you are equipped to deal with future traumas, and are able to minimize the impact of those future traumas through the training that you've received. And you know, I just can't, you can't underestimate the importance and the value of being more trauma informed. And I
yeah,
personally myself have not been. I've been through my own traumatic experiences, of which there are many,
yeah,
from childhood all the way through to the near present day, and actually the present day, and have to talk about that. But if I hadn't taken the time to be more trauma informed myself, and now subsequently help people, um, I would be a much more agitated, angry, impulsive person,
mm,
and much less calm and composed in dealing with situations. And I'm really grateful that I took that time
yeah,
to down-regulate myself.
yeah, yeah, yeah.
Mm.
I'm really sorry to hear about your experiences, but it's unfortunately it's really common,
It's
and
so common.
we just don't like to think that's true. So we live in a world where we just rather think that bad things don't happen, and of course, you know, we would all rather that that's the case. But the reality is that bad things do happen, and unfortunately, they happen very frequently.
Yeah.
So that denying that it actually happens just adds to the wounding and that ignoring that this is actually a thing and that there are then
Mm,
consequences.
mm. And actually, you know, reviewing the guests that have been on my show, although I don't have the actual figures, but I would say 2/3 to 3/4 of my guests have had traumatic experiences from
Mm,
childhood,
yeah,
um, and often that have gone unaddressed, and been boiling underneath the surface, and express it, you know, being expressed in a multitude of different ways as adults, that have resulted in ultimately for some people it's been a breaking point where they've
yeah,
had to ask for help. That's often what happens.
absolutely.
Yeah.
Yeah.
So before we dive into this, because I know we've got so much to talk about, and I have a feeling we could talk for hours on this. But before we dive in, what is optimal brain health mean for you personally in the context of your life's journey?
I think it's about just doing things day to day. I think we often, and I've been guilty of this and kind of learnt this the hard way, that idea of looking after my brain health is because there's something wrong with me rather than it's just to keep well. So we all know about being physically healthy. We talk about the need for, you know, eating 5 a day and exercising, and people can rattle those things off, but don't consider it's not just about our body. You can't take this off. You know, it's about our brain and our body. We're one holistic being, and it's about integrating that and just looking after ourselves day to day to maintain our well-being.
Yeah. Do you know, I absolutely 100% agree. And isn't it so easy, or hasn't it been so easy in the context of how medicine has shaped itself, to separate all these different parts of us
Yeah,
rather than actually look at the whole person,
yeah,
and the whole impact on that
yeah.
person?
And
Because we know
especially,
that, you know,
I
the
mean,
boy keeps the score as well.
exactly. And I mean, if you think about traditionally how hospitals are set up, psychiatry is in a separate building. Like you've got all of the physical health things in one bit, and the mental health is kind of even completely separated, when it's all interlinked.
Mm. And I want to share a story with that, my own personal story, actually. It is, I really hurt, and it doesn't seem like much, but it's importance of how everything is interlinked.
Yeah,
I, for some reason, after I went away on holiday, I went cycling, got in the car to go home, got out of the car at home, and I could hardly move my leg. My hip was kind of like, it was really difficult to move, like chronically
yeah.
painful. And then when I started walking up the stairs, it got acutely painful. And
Gosh.
I couldn't understand how it happened. It just randomly came on. And so I went through the normal NHS system, which was really difficult. So I thought, you know, I'm just need to get this solved because I'm in agony. So I went to a physiotherapist, booked myself in privately, £55. And he said, when he assessed me, he said, your brain is telling you that it's painful in your hip. You need to decouple the physical pain that you're actually experiencing, which is minimal, from the psychological pain that you think you're experiencing,
Yeah,
which had been coupled together, and
yeah,
break the two, and the pain will significantly reduce. And I thankfully have havening on my side, and
yeah,
I used havening to break the two pain elements, and was massively improved my pain levels
gosh.
by
Yeah,
doing that. And we forget that, don't we? That
I do.
it is interconnected.
Absolutely, absolutely. And it's so true what I was talking about this earlier. I think it was earlier today or yesterday with someone, that how we can collapse things together. So when things happen around the same time, we just in our brains collapse those together. So then we can have an association when there isn't a link, and it's
Yeah,
about connecting things.
yeah.
Absolutely.
And also we can collapse things together from our history. So, you
Absolutely.
know, people, I had a client who had a knee injury, and was unable to walk, and it was associated with the previous knee injury. And there was a lot of psychological trauma tied into the knee injury. And when
Yeah.
we broke that, they were able to run in 3 days, and they've been, you know, kind of total limited mobility.
Yeah.
So it's really important. You can't, you know, for me, is that you look at the whole history to know
Absolutely.
where it's joined together,
Yeah.
which is why I find it so fascinating.
Yeah. 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 No, very true.
So I'd love to dive into your story of what led you to wanting to help people become much more trauma informed.
Yeah, so I mean, I'm a GP, like you said, and I've been, I mean, I qualified as a doctor in '99, so I've been practicing for a very long time, and
That's
yeah, and I've been, I've always kind of had an interest in mental health. I've always kind of veered that way, and so although I trained as a GP, I've always kind of veered that way. I've set up mental health services when we lived in Sydney for a while. I worked there for 5 years. I worked in clinical commissioning in this country. I was a lead commissioner for mental health. So it's always kind of been my bag and my interest. And then it was 7 years ago now that I realized things weren't right,
mm-hmm.
but I'd had kind of 20 odd years of periodically not feeling right, being told I had depression, being on antidepressants, seeing umpteen therapists, and just getting up to the point of being okay and being able to function, but never actually resolving it.
Okay.
And this particular point, kind of 7, 8 years ago, lots of things had coincided. And I ended up disclosing. So I ended up going to see a therapist, and saying again, look, I think I'm a bit stressed. I think I'm depressed again. And we kind of spoke, over a number of weeks. And she said, look, actually, I think that I think you've got more anxiety symptoms. No, I don't. I don't identify with that at all. And she kind of then very gently said, look, actually, I think you might have post-traumatic stress disorder. And I did say, do you know who I am? I'm a doctor. I would know this. And I totally did not recognize it at all in myself. And she was amazing and very gentle and very compassionate. And she advised and guided me to seek help from a specialist, so a therapist who specialised in trauma, being very careful so I didn't feel rejected. I mean, she was brilliant how she did it. And she said, look, the best thing is don't go away now and read up about trauma. Just make sure you come back next week and we'll explore it a bit more. Obviously, I went home and read up, Googled as much as I could about PTSD, and particularly complex PTSD.
Yeah.
Which at that point I'd never heard of. And I literally fell apart. The next morning, I was at the GP surgery. It was me doing the early surgery. So I was there at 7 o'clock in the morning. And by 9 o'clock, I was a sobbing heap in the corner of the room. I turned all the lights off. I couldn't stand bright lights. My colleague came rushing in, checking to see what had happened. And I was sent home for 2 weeks. And I actually didn't work for 6 months. And everything, my whole world fell apart. I couldn't be in a room that was bigger than a small room. Like anything bigger just felt too frightening. Just that space felt too frightening. Distance, depth perception and color just was all distorted. And I literally thought I was going mad. And it was absolutely terrifying because being a doctor, I use my brain. Like that's what I do. That's my job. That's my livelihood. And it was only then through the help of this trauma therapist who just normalized everything. She was like, yeah, you feel like this. Yep. That's all part of post-traumatic stress disorder. And then I started researching more and thinking, this is ridiculous. Like, what is going on in my brain and my body? That I started finding books like from Bessel van der Kolk, The Body Keeps the Score. Yeah, exactly. And eventually found a course in Chester University, a master's in psychological trauma. And I signed up, never thinking I'd finish it, just to try and learn what was going on with me. And I was just at the same time horrified and amazed at how much research there is out there showing what we can do. There is so much help available, and yet I didn't know about it. And I thought, if I don't know about it as a doctor who specializes in this, what are we doing? And it completely transformed my practice. So it's almost was like putting on glasses and being able to just see everything clearly. And it just made so much sense to both the patients that I was seeing, but also how my peers were being impacted by working within the health service. And since then, it's just really become my passion and my vocation to help as many people understand, recognize what's going on in their body, realize there's nothing wrong with them, that these are just normal responses to an abnormal situation, and just get as many people as possible to that point where they feel trauma informed so they can help more people and we have this ripple effect.
Isn't it really sad that people don't realize how much support is out there, and also how much power we have within ourselves through holistic techniques that tap into beyond the spoken word to help us unchain our pain. And there's just so many tapping, and I'm sure you can reel off brain spotting and havening and somatic experience and the family systems that people often use. And I'm sure, do you have any other ones that I haven't already said? I'm sure
I mean, I think it's a really, I think it's a really important point to make, that for a lot of people, talking therapies don't work.
Agreed.
So, you know, talking therapies is often the first port of call. It really helped me to start with. Having been validated and being seen and heard was hugely helpful in my healing journey. And for some people, that having a space to tell their story is really, really important. But for many, going over things is re-traumatizing, because you're going
Agreed.
over and over it, and it takes people back to that point when something happened. And that's
And just from a brain perspective, yeah, it's really harmful. And just from a brain perspective, is the more we use it, the stronger the pathway becomes in our mind. You know, we relink neural networks that actually we want to break. And so it can be so damaging for people, particularly when the trauma is, well, it doesn't really matter, but you know, when it's an incredibly traumatic experience, it's like rebuilding a motorway that you're trying to break up. It's not something we want to do. And I think the other thing that I find fascinating, the concepts of talk, is that often we can be traumatized before we have the ability to talk, you know, in the context of childhood trauma. And so your brain is not mature enough to articulate the verbal words that relate to the trauma, but you experience the trauma somatically, you experience it cognitively, you experience it from an autonomic perspective, but you can't, and an emotional perspective, but you can't articulate it from a verbal perspective. And so using words and speaking about it is not going to remove it in the same way that you can do with other techniques, because you want to either tap into the source as to how the trauma was encoded, or the outflows that relate to the trauma response.
So it's absolutely, it's where, I mean, that's where that title from Bessel van der Kolk is so great, because the body knows the score. It's held in the body. And so this is where people thinking it's you know, it's up here, that people are, you know, they just need to talk their way out of it. It just doesn't work. And I remember one of my teachers, when I was doing the masters in Chester, said it's like trauma is like a dandelion. So, you know, dandelion plants, like a kind of a weed that have really deep roots. So talking therapy can help pick the leaves off, but it doesn't get rid of the roots. And it's that image just has really stuck with me. And so it's things like like you've talked about, the body work of somatic experiencing, or internal family systems, or even things like acupuncture can be hugely helpful in really helping move those energy blocks around the body. So there's so many different things that people can go and see a practitioner about, that are not just that talking therapy.
Massage is also really helpful. So some people have, you know, although it's not a therapy by any stretch of the imagination, massage. But often people have a huge can have a huge emotional release through massage, because our skin is, you know, considered the third organ, third brain, because of the sensory connections to our brain and how it's held there.
But some people might find that too hard.
Exactly.
To be touched and to be exposed in that way. So it's I think what I really want people to understand is that, you know, yes, talking therapies can be brilliant. There's something called EMDR, which is eye movement desensitization reprocessing, which is fantastic, but there's a whole load of grounding and stuff that happens around that. So there are these modalities that are great. And if somebody cannot face talking to someone, or cannot face talking about it, or doesn't want to be touched, there are so many other things that can be done. So things like we said, EFT or tapping, acupuncture, brain spotting, but also in general, just looking at how we're living our lives and doing things like the really, really simple things, like going out into nature, seeing daylight,
meditation, grounding.
Meditation, making sure that we're eating healthily. It's because if we think like at a really basic level, what's going on in our body, this normal response to an abnormal situation, that's an acute stress response, and that's what keeps us alive. There's nothing wrong with that. That's entirely normal. What becomes a problem is when it's not switched off and it becomes chronic stress. And then when it becomes chronic stress, that leads to inflammation throughout the body. And that's the thing that causes problems. That's where all the medically unexplained symptoms are so linked with trauma. And it's not as simple as saying if someone's had trauma, then they're necessarily going to end up that way. There's genetic predisposing factors that come into that. So it's the context and the background and the life story. There's all of that comes into it. But doing things to help calm the inflammation. So by trying to, as much as possible, and I appreciate this is hard, but trying to reduce our sugar intake, reduce our alcohol intake, eat whole foods, eat vegetables, get some exercise. That might just be going for a walk, see some trees, stroke a dog. Just really simple things can be hugely, hugely healing. So often people think it needs to take loads of money, but actually there's a lot that individuals can do themselves.
Yeah, and I think I 100% agree. And one of the things that I love for myself personally to downregulate myself, depending on the stress response that I'm having, because you can use different tools to downregulate. So if I'm really angry about something and I'm angry stressed or stressed angry, I like to use a physical activity to downregulate, to kind of run it out. So, and I often encourage this with my daughter. If she's angry, kids often stamp their feet in anger, is I tell her to run it off. So it's constructive release rather than a destructive release. Conversely, if I'm sad or I'm anxious, I might choose to go out for a walk in nature, or just literally lie on the floor or lie on the sofa for 5 to 10 minutes and just do some deep breathing activities, just some calming breathing, and just feel almost like grounding my body. So unless we practice and try these things out, we're not necessarily going to uncover the amazing opportunity to support ourselves that's already available to us.
Yeah, absolutely. And it's that where it's understanding there are no bad emotions. This idea that they're good emotions and bad emotions. Anger's really helpful. Fear's really helpful. Sadness is, it's all just part of the human experience. So if we can learn, I love that you teach that to your daughters. If we can teach children from a really young age not to be afraid of any emotion, but just recognize it, acknowledge it, and let it move through us. So by running or stamping or even lying on your bed and just, kind of like a toddler, I get people to do this if they've got mobility issues, is just to punch them and kick the bed. You're not going to hurt yourself doing it, but it's that release is really helpful.
I agree. And I think we often go on, you carry on.
If you're sad, to cry, to just let it, and it's just allowing that emotion to move through us, because it will pass. They never stay. They're like waves. They'll come and then they'll break, and then they'll come and then they'll crash down. And
I always like to say we're on an ocean of emotion.
Yes. Yeah.
And so like we're on our ship on the ocean, and we want to navigate a course, and we can choose to either hold the tiller on the ship and navigate it and watch watch the waves of emotion that are there and use them to our advantage. Or if we don't have the skills to hold the tiller because we haven't had the training, we often hide in the galley area or hide down beneath the ship, and then we're a victim to the waves of emotion. The key thing is to try and get yourself out from the depths of the ship and learn how to become a captain of your ship, or your emotional ship, as it were, and learn to use the waves to best effect to help you rather than to capsize you.
I love that. That's such a great analogy. Yeah, it's really good. Absolutely.
So I'd love to dive into your past, if you're only if you're willing to share that. Obviously there was something that happened historically that led you into being interested in mental health in the first place. Would you mind sharing any of the stories that you've been on, any of the traumas that you've experienced?
Yeah, so as a young adult, I think unfortunately this is really common for women. I experienced sexual trauma more than once. And whilst I went to seek help, I was just told that I had depression. So where now I can look back and go very, very, very clearly, it was blindingly obvious that I had PTSD. I was told that I had depression, that I had a part of my brain that would always be sad and negative, and I just had to accept that and live with that, which was at 19, 20, quite horrific to just accept that. So I just pushed it down as you do. It's a very normal trauma response to just suppress it and push it down and just try and get on with it, and just immersed myself into medical school training. And you know, often, as you can see when you read kind of literature around trauma, when we have a pattern, when we're exposed to something, then sometimes we don't read things properly and we can be exposed again. I had another incident happen when I was at medical school. Again, I was told it was my fault because I'd had a drink, even though it wasn't like I was completely drunk, but that's never an excuse. So there's always this blaming, and there was just something that I knew wasn't right. Like somehow something that I was being told, it just didn't sit right. And I remember we had to do like a mini dissertation in my second year at medical school, and I argued, I got a really bad mark, but I argued the case that medication and psychiatry wasn't the answer, that we needed to change things around ourselves, as well as maybe take medication and see medical professionals. I barely scraped a pass for actually saying that, but it's interesting that, you know, I was like 22, 23. And then going through medical training is tough. Like what we see, what we're exposed to is really hard. And there's no forms at all of debriefing.
Wow. That's not, it's not putting, you know, militarily speaking, we didn't used to have this training that people needed in order to deal with the situations that you get put in, and isn't it sad and shocking that that's not offered in emergency services personnel like yourselves?
No, and it's something, there's a lot of research showing that medical students from between the first year and the fifth year, their compassion changes. So their compassion for others decreases, which is horrific. And, you know, I then started specialising in paediatrics. The amount of horrific things that I saw, you know, I mean, but it was part of the job. It wasn't that I was any different. It's just was part and parcel of what I was doing. But all of that just kind of built up and built up and built up. And then I'd ended up doing a really, really stressful job in an organisation that was very poorly managed. And that was it. And so the way that I often explained the idea of trauma is that, thinking about this idea of having like a big bag of worries, or a big bag of a big kind of bucket of stones, and there's rocks and stones, you know, there's really big things that you can put in there. So with me, it's things like sexual assault and seeing horrific things in my training. But then it's also, you know, whether it's cost of living crisis, whether it's parents becoming unwell, there's lots of things that kind of add on. And then it may be that just, you know, a friend forgets your birthday, or the light bulb in the mirror goes in the bathroom when you're trying to get ready, and you just snap.
Your trauma bucket's full and it spills over because you can't hold it anymore.
Exactly. So I know for me that there was a build up of just more and more stress. And then I saw a patient who just reminded me of something horrific that had happened. It was nothing to do with that patient. It was nothing that they did wrong. There's maybe certain phrasing that they had that just was a bit sexist. You know, we hear that all the time, unfortunately, still. And that was enough to just remind me of an assault that had happened. And that was it. And it's understanding that everything that I had kind of been loading up over decades then just spilt out. And it wasn't, you know, that the reaction to that incident that had happened that morning, it was nothing really to do with that. It was nothing to do with that particular surgery, that particular patient, that particular consultation. It was way more than that. And it was decades of trauma, of grief, of anger, of hurt, that just my brain and body just didn't know what to do with. And once that had opened, it just all came out and overwhelmed my brain to a point that I just couldn't function, literally.
Yeah, and I think that often happens to so many people. You know, Dr. Philip Alexander's on the show. He's a paediatrician. He was talking about how his, you know, childhood trauma and then becoming a paediatrician or stat, you know, he was passionate about helping children because of his experience.
Yeah.
And then the stress of the workplace environment just tipped him over into depression. And he obviously had to get help, but the problem there was the help wasn't available for 18 months. So we had, you know, an open wound that was gushing for 18 months because of the broken system that we have here in the UK, which makes it so much harder for people to heal because they're dealing with this open wound for so long.
It does. And I think, and it's something that I very much reflected on at the time. I mean, it was a huge financial burden, me being unwell, and it's something that I'm still dealing with that. And you know, I could manage just and had support of my family, but we're still, you know, years later, there's the repercussions from that. And it's understanding that, you know, many people aren't in the position where they can get help. You know, the therapist that I saw was private. And it's a lot of money. And I tried to get help through the NHS. I tried the normal routes. I was met with just you know, what would you like to do? And I couldn't even sit down. I was pacing. I couldn't even sit in the waiting room and wait for my appointment. I was too anxious. And so this complete lack of understanding and recognition and understanding of how to help in a really small way of just teaching people grounding techniques, you know, reassuring people that they will get better. This idea of saying, you know, there's fundamentally something flawed and wrong with you. Let's give you a personality disorder label because you're kind of really anxious and struggling here. You know, for a lot of people, either they go into that because they have no other resource, and then they end up down a route where often they're just really medicated and end up with loads of psychiatric labels, or they just go away and try and avoid getting help because they're so fearful of that. And then they kind of fall apart quietly and no one really notices. But there is so much that we can do without it needing to cost the earth.
Yeah, I completely agree. And, you know, my experience, I can relate to your sexual trauma that you had during university. I had a similar experience, which was tied back into an adverse childhood experience I had. And what ended up happening for me is I suppressed it, like you said, but I became very angry about the way in which I was treated. And in fact, I became my own worst enemy in the context of how I behaved as my defensive response mechanism, making the whole situation a whole heap worse, because I was so angry and I wanted to be in control, as it were, because I wasn't. And I ended up having therapy right when I was finishing my PhD and going through a Viva. It was a whole heap of mess I created because of my behaviour. and it was really difficult, because the therapy I had actually didn't deal with the behavioural problems that I was having, which I can reflect on now and better understand, but didn't address how I was responding to the situation, my continued response associated with my past trauma, that I was not able to decouple until much later, beyond the therapy, when I got into brain health coaching and so on. And I think it's really important that, we mentioned earlier, is understanding how we respond to those situations, and the why we're responding in that way, and what we want to do to change it, so that we are having a constructive relationship with ourselves and with others, rather than a destructive one.
Yeah, absolutely. It's that recognition and understanding that just makes all the difference. And I think, the amount of therapists, I mean, I don't know, I was trying to work out the other day, at least 10, 12 over the past 20, 25 years. And only one actually picked up what was going on. And it's, and I just kind of wanted to say again about, just kind of go back to that point about medical training. And I think it's not just for doctors, it's for nurses, anyone kind of in that sphere. When Adam Kay's book came out, This Is Going to Hurt, and then when it came out on the BBC, there were so many healthcare professionals that just said, I can't watch it. It reminds me too, it's not funny. It was kind of billed as a comedy. It's not comedy. This reminds me too much of my own training, my own work. And yet we still don't do anything about it. We still don't acknowledge it. We don't acknowledge all of the stress that's associated with that work. And there is so much that we can do. So like you said, if we recognize those responses, if we can see what happens, we can prepare people for it. If we put things in place around debriefing, around, understanding what's going to happen in the first place, debriefing, recognizing responses, then we can help people not get into that situation in the first place.
And it's so important. It's that awareness piece, isn't it? Because when you're living and reliving a past trauma, because you're in an automated response that's been conditioned in your survival instinct that keeps us alive, until you can pause and stop and go, okay, I've got the power to change the film now, because I'm the director of my own film. Until you take that time to pause and reflect, it's very hard to accept how your film is playing out, whether that's your past film or your present film.
Yeah, absolutely. And it's something that I think, over the years, I've clearly treated countless people who've experienced trauma, and who have signs and symptoms of what we would call PTSD, and I didn't recognize it. And I think a lot of that is because I didn't recognize what was going on in myself. So if I don't recognize it in me, how am I going to recognize it in others? And it's then having that understanding. Like I said, it's like then putting on glasses. You're like, oh, right, that's okay. Now I get it. That's what's going on. And then it just shifts what you do. It shifts how you talk to someone. And it just then takes that treatment, that healing for that person, that interaction down a completely different route.
Yeah, agreed. And I think the other thing that's really important for me personally is how we approach the conversation with that person, because I know I have a real bugbear about this, and you can absolutely shoot me down if you want to, but when we typically have mental health conversations, you mentioned at the beginning, I was just about okay. When mental health tends to be being okay rather than performing optimally. So we get to 50% out of 100%, which is okay. And then we can stop doing the work because we're okay. I'm not okay with 50%. out of 100. I want to be 90% and above in terms of performance. But the other thing I find with mental health, and the way that the mental health labelling has evolved over the course of history, is it's come from a very them and us culture. Is I'm perfectly fine and you're not, that particular culture. But also because of the way that we've been doing the labelling historically, why the earth we haven't had the foresight to change it, given we've got all of these gender changes that we're completely capable of dealing with, is we label somebody as being faulty. So the disorder is a classic, rather than viewing them that they're hurt and they have a wound and they need to heal. But the way that the conversation pans out is we talk about, I have a mental health problem, versus when we talk about brain health, is my brain is in trouble, same as the heart health, and my heart's got a problem. So you're taking the focus away from the person being faulty and looking at the particular part of the body or mind that is struggling. So you can look at it much more subjectively and look at the system, the whole system that's causing the problem, rather than the person being seen as the problem. So, you know, like when my daughter had a heart murmur, it was super easy conversation to have with her, because we could point to a heart, we could talk about it, the heart could be in trouble and so on. It's simple, easy, understandable. Same with the brain. Mind, look after your brain, and we can talk about the software and the hardware in our brain, and it's people can contextualize it and understand it, whereas mental health can sometimes be a bit ethereal and difficult for people to grasp, and the language is very much focused on the person being faulty, rather than we needing to heal a wound inside or outside or both of that particular individual.
And I also think there's so much fear around it. Like, it's if somebody says that somebody has a mental health issue, people become really afraid, and they're like, oh, don't quite know if I can work with that person, how I can talk to that person. And so there is still such a stigma around actually being honest and saying, I'm not okay. And I've got mental health issues, or I'm struggling with my mental health. It's then people just look at you as like, well, can you cope with life? Like, can you do your job? And so there's this huge fear, both about acknowledging it and stating that that's the case, and also then for the other people on the other side of treating it. And I see this all the time, that there's a real fear around just, you know, then if you mention trauma, then is on top of that, it's like people just want to separate it all out. It's like, oh, that's a whole other thing, I'm just not going to talk about it. But the problem is, when you don't acknowledge it, when you don't validate someone when they're trying to say something and trying to say, look, I think this happened and maybe this is part of what's holding me back, people just want to shut it off. And it's those behaviors that were originally survival responses that are often the bit that's holding someone back. That, like you say, they're functioning, but they are so terrified and have such crippling self-doubt and so much shame that to stand up for a promotion, to be seen at work and to say, actually, no, do you know what, I deserve a pay rise, to put themselves forward for that, you know, that bid, that presentation, there's just too much that they can't do it, so they hold back. But so we've got these untapped brains and resources and this wealth of knowledge and wisdom that we're just not using because people are too afraid. And yet, if we actually can help people to make the links, if we can acknowledge it and recognize it and validate people, we can help them to fly.
Yeah, I completely agree. And I think it's so easy, isn't it, for sometimes us to put people in that mental health bucket, then they get put on a mental health pathway that doesn't suit their needs, and can easily get lost in the system because they've been allocated this bucket. Whether it's the workplace, as it was for one of my traumatic experiences, being told I had no emotional intelligence shortly after having a miscarriage at work. you know, getting put on a pathway to being told, oh, you know, within 3 months we're going to stop paying you because you're on this particular pathway, and all you want is for the pain to go away.
Yeah.
Just like if you had a broken
Yeah.
leg, you know, you don't get well, you depending on your work circumstances, but people tend to be more compassionate and more aware,
Yeah.
and more supportive if you have a broken leg in the work, because they can see it.
That's the thing. It's about something that's visible, and then people are kind of comfortable with acknowledging it, with stating it, with showing compassion around it. And that's where this idea of being trauma informed is so important, because, like, you know, we've both talked about that unfortunately we had experiences with sexual assault when we were younger. There's a report from the NSPCC that actually 31% of 18 to 24-year-olds talk about childhood abuse. You know, these things happen so commonly. 1 in 5 children lives with a perpetrator of domestic abuse. This is not something, these are from this country. This is not something that's out there that is just not happening to, you know, it happens only to those people over there. It's not going to happen to anyone near me. To me, if we work with people, we're working with psychological trauma. And so to not understand it, to not, like you say, be able to recognize it, recognize the behaviors, we're really doing them a disservice. Because just with that recognition, and then, like you said, the language that we can change around how we speak to someone can have a profound impact on that person's future, not just in that moment, but the whole trajectory of their life.
Yeah, I 100% agree, and I think it's so sad that we are not equipping people with tools that are available now to take into the coaching environment, to take into schools, to take into the workplace, to help people be more trauma aware of themselves. You know, if I encourage anybody who's listening, if you're able to, only if you're able to take the time to write down all of the traumatic experiences you've had in your life. You don't have to go into any more, you know, you don't have to write the words, because that can be traumatic in its own right, but just try and, you know, list out how many, and you'll have a whole, often people have a whole stack of them. And the more you think about it, the more you can uncover. You know, I've had all sorts of trauma from childhood. We'd be here for hours if I talked about all my trauma, but you know, we have a whole heap of it, don't we? Some of it is massively impacts our behaviours and how we show up, and some of it, we, you know, depending on the environment and the circumstances and how we viewed it at the time, we can go, yeah, learn from that. I can move on. But it's having that awareness personally and being trauma informed about yourself, like you said, and then it's much easier to be more trauma aware and compassionate about other people's.
Yeah, absolutely. And it's, you know, it's understanding not everybody who lives through a traumatic experience goes on to have consequences. So it's roughly between, you know, depending on what happens. So if it's sexual assault, if it's sexual trauma, it's between 50 and 60% go on to have consequences. But, you know, it varies from between kind of 10, 20 to 50, 60% of people go on to have consequences, depending, like I said, on what happens. And obviously that takes into account the context of what's going on around them. So, for example, unfortunately, there's 78% of young women and girls who disclose sexual assault are not believed. So if they're not believed, then that's going to suppress even more their, you know, their belief in themselves that something's wrong, and that they are validated in not feeling okay and finding things difficult. And like you said, there are so many different causes of trauma, and some of them, you know, might be something quite small, something might be a really big thing, and again, it's very much the context of how it impacts somebody. But it's understanding how that can impact our physical health, but it can impact our behaviors, the way that we interact with people, the way that we build relationships with people, the way we're able to work, the way we can show up in the world. And so just that understanding, I mean, we keep coming back to that understanding, just the understanding, it totally can transform people's lives. And
Yeah.
it's that absolutely that point that you are not broken. You know, if there is something that's happened and you're impacted by it, it means you're human. It doesn't mean there's anything wrong. It doesn't mean that there's anything faulty or broken that needs to be fixed. You're having a normal response to an abnormal situation that, okay, maybe now isn't serving you. So we need to unpick it and look at those learned behaviors and see how we can adapt and what we can do instead. But there is absolutely a way out. That's what's so important. There's always a way out. There's always a way through.
I 100% agree. And, you know, in the context of people experiencing trauma, that it, you know, any type of abuse, how it is encoded in your mind as the victim of the abuse can be very different to how it's encoded as the perpetrator. So a victim, because it is traumatic, because it's a physical trauma and we've gone into survival response, will be very easy potentially to recall that experience, because there's an emotion, there's a lots of different components, particularly an emotional one, associated with the trauma that they've experienced. Conversely, perpetrators, if they do it a lot or it's not perceived as something that's wrong by them psychologically, they might not even remember it, because it's not encoded in their mind to be a memory that's worth holding on to. So it's very, you know, that, and the same applies if you're lots of different people in the same situation. How we are positioned in that situation and what we see and how we see it and what our previous life experiences are will depend on how much we see it as a traumatic experience versus it's just common day occurrence. So if you're listening and you've had a trauma and, you know, you're comparing yourself to others or you're comparing yourself to the perpetrator, please don't.
No.
Because the trauma is what's happened inside of you as a result of what's happened to you. And if it's hurting and you feel like you have an open wound still, then please go and get help, and please go and get support.
Yeah. The way that traumatic memories are kind of filed away in our brain, it's not filed away in the way that other memories, kind of conventional memories, are. And that's why they are attached to the sensory parts of our, you know, the sensory memories. So that's why it's with smell, touch, sight, sounds, and taste. And it can just flood our brains when that comes up in a different, you know, a different stage later in our lives. So it's very much just how memories are encoded and embedded and how they're formed, that they're kind of misfiled in a sense. And so the treatment of trauma, when we talk about processing memories, it's about those memories. Unfortunately, you can never forget them. You know, what's happened has happened, but it's about those memories being filed away correctly so that we can choose to access them or not. And that we don't get kind of triggered and then flooded and hijacked by them.
Yeah, agreed. And we do have the power to change our memory as well. So a lot of the work I do with clients who have very complex trauma or, you know, extreme trauma from the event is you can, as I mentioned, you're the director of your film. So you can, and I did this for when I experienced the loss of my dad and witnessed his passing, is I added magic into my memory of that particular event, and made it a much more calming experience by changing how I chose to recall the experience. So there's and you can put walls up and all sorts of stuff. So there's lots of ways in which you can choose to recall, you know, change the recall of the cognitive encoding that you have as part of your mind, and you know, through other techniques and metasensory and stuff, you change your autonomic response and so on. But it's understanding what your outflows are, and how is most appropriate to address them is what's really important, with finding the right therapist that is going to tap into the outflows that you need to down regulate.
Yeah.
Sure,
But
they're reduced to a comfortable level.
it's even like what you were saying earlier, that if you're talking about the same thing over and over again as something traumatic, you're reinforcing that pathway, you're reinforcing that brain, that neural pathway.
Yeah,
So if we choose to create other memories and think about other things, our brain, what's amazing, our brain doesn't distinguish between what actually happened and what we imagine has happened.
yeah,
We can choose to think about and visualize and imagine something else and something different, and create a safe space that we go to in our brain, and really pad that safe space out with what we can see, what we can smell, what we can hear, what we touch when we put our hands down.
yeah.
And that can become just as strong a memory. It's something that becomes then a new neural pathway, and we can create that. And that's exactly what is so exciting about working with trauma, because we literally can change our brains. We've got the capacity to do that.
You know, I absolutely, I find it so utterly fascinating how malleable our brains are, how powerful they are, and how we're just really not tapping into the potential we have to unchain our own personal pain, and informing people, you know, being more trauma informed about the fact that you have an enormous amount of power within you,
Yeah.
particularly when we tap into our five senses and use
Yeah.
them for us,
Yeah.
to create a what we sometimes call post-traumatic growth. Is we
Exactly.
take the trauma and we turn it into a positive learning experience, and actually
Yeah.
it propels us forward in life.
Yeah. I think we're
So
both an example of that by the sounds of it.
yeah, I think
Yeah.
so. So I know we've talked a lot about trauma. I've had such a fascinating conversation. What piece of advice would you give to anybody who is struggling with trauma, and maybe they're worried? We talked about shame or the disclosure of it. What would your advice be to anybody who's struggling? They feel they've got an open wound.
Fundamentally, there is nothing wrong with you. It's not your fault. There's nothing you've done wrong. And these responses are normal responses to an abnormal situation. And there is help. There are ways out. There are things that you can do. We've talked about some of them today, but really starting slowly with being compassionate and kind to yourself, and knowing that you've done nothing wrong, you've done nothing to deserve this, and that there is going to be a way out.
Mm. I think it's so important to recognise that, and you know, there's always light at the end of the tunnel. And remember, somebody's been down a similar tunnel before you, and they can show you the way.
Yeah.
So don't be afraid to reach out for support to Dr. Susanna or myself or anyone else who you trust,
Yeah.
who might not be able to be the therapist for you, but signpost you to people who could support you.
Yeah.
With that in mind, Dr. Susanna, how can people get hold of you, learn more about becoming more trauma informed?
So yeah, thank you. So my website is just my name. So it's drsusannapetche.com. And there's a page in there about my Trauma Sense program, which is a pioneering program to teach coaches, life coaches, and other healthcare professionals to become trauma informed. And so we're starting a new cohort at the end of April. So if anyone's interested, please take a look. And just can connect with me through LinkedIn, or through my email, which is through my website. So love to hear from anyone. And yeah, thank you.
No, you're most welcome. I do really encourage people to reach out to that, particularly coaches, because there's a very fine balance as a coach where you can open Pandora's box, as has happened to other guests on my show, and
Yeah,
not have the tools and techniques or experience on how to deal with it. And once the Pandora's box gets open, it's very difficult to put that lid back on.
exactly.
So it's
Yeah,
really important as a coach that you do get that training,
yeah.
to support you in becoming more trauma informed. So do reach out for that. Dr. Susanna, it's been honestly, I've had so much fun with this conversation. Thank you so much for coming on the show. I'm super excited to stay connected with you
Yeah.
and learn more about your trauma informed programs that you have, and thank you for sharing your journey, sharing your story, and being a force for good and an opportunity to shine the light for people, to help them find their way out of the pain they're in.
Thank you. It's been a real privilege being on this podcast with you. It's been really good fun, and thank you so much for the work that you're doing. It's
Oh,
awesome.
no, you're most welcome. Remember, everyone, this show is all about brain health, unchaining your pain. You are not stuck with the brain you have. You have the power to make it better. And Dr. Susanna Petche's kindly been here to show us how.